Get started. I see lots of friendly faces out there. So the first thing we have on our schedule, and I'm going to jump right in because we have a full one, is Leslie is with us to talk about Social Drivers of Health initiative and also the CME collaboration. So I will turn it right over to you, Leslie.
Good morning, everybody. Thanks, Claire. Be very brief this morning. Just have two things to touch base with you on, as Claire alluded to. Wanted to remind everybody that PA Med does have the chronic care management social drivers of health initiative still going on. This is an endeavor we've been working on all year. We are still accepting practices. And while our initial reporting period will end the end of December, and we'll report our results in January, it's our hope that we can continue to offer this service to a select number of practices every year so that we can help members across the state every year really focus on chronic care management and incorporating those important aspects of social drivers of health into their conversations with their patients. For those of you not as familiar with the project, some highlights: the physicians that are participating can earn more than 20 AMA PRA Category 1 credits. Practicing physicians can earn $1,000 stipend. And PA Med is helping to provide all the resources that they are using with their patients, as far as the community resources reference that they can use. We have patient surveys that we're giving to them. We have currently we have a social worker from the CIN-CCC that's available to also provide free conversations or consultations with patients that choose to say that they want to have follow-up. And we also have a public health student, a master's of public health student, working with us right now as well, that's available to help. So a lot of great opportunities for practices to try and improve patient outcomes. If you're having conversations with practices, consider, if you will, talking with them about this initiative. And, because in addition to helping their patients with outcomes here and the small stipend that we're able to provide, they may be able to roll this up into a performance improvement initiative with some payers, and there might be some additional revenue for them there. There is a page on the website specific to Social Drivers of Health and Chronic Care Initiative. I'm sure that Claire's team will be happy to share that with anybody if you're interested in learning more. And you are welcome to reach out to me at any time with questions about the initiative. As I said, we are taking practices in. I will tell you, because I'm not sure where everybody is from currently, we have a practice from Westmoreland County, we have a practice from Lancaster County, a practice from Lebanon County, and a practice from Berks County currently participating. I believe next week we are onboarding a practice from Bucks County. So, and the chronic care conditions they are focusing on are either asthma, COPD, diabetes, or cardiovascular disease. So there is a lot of flexibility that we can help them customize their project to what's really important to their practice. So that's the first topic. The second topic, I just wanted to remind everybody that in 2023, we rolled out the County CME Collaboration Initiative, and there is a committee that is still in place. For anybody that's new, this initiative it allows county medical societies to submit, if you will, a proposal through this work group. And if your idea for a CME activity that you would like to host or help facilitate is accepted, your county will receive a stipend to help underwrite some of the costs. In 2024, that stipend amount will be $2,000. PA Med staff is available to help with certain aspects of planning that activity or delivering that activity. If anybody has any questions on that specifically and you'd like to talk to somebody at a county level, I encourage you to reach out to TJ Huckleberry for some guidance on that. I know TJ and I talked at House of Delegates a little bit. We'd like to sort of like revamp it or ramp it up, I guess I should say, for 2024. So I wanted to remind all of you that it's available. And as a helpful tool, maybe for some consideration, because I do understand from talking with some execs that you all have the drive to do this and take advantage of it, but maybe you're not seeing the support that you'd like from your physicians and thinking about what topics might be relevant or useful. So I will say that over the summer, PA Med sent out, the comms team sent out a survey to members and non-member physicians alike, asking them, what sort of what aspects of patient care are being or I guess I should say underserved, or maybe overserved in your county, what things are occurring in your community that would really benefit from education, and then how would physicians benefit from the education. We had representatives, we had approximately 105 responses to that survey. I believe 80% of them were from members, maybe 20% of them were from non-members. And these responses represented 35 different counties. So I do have I have separated the responses into an Excel spreadsheet, and assigned the names and alphabetized them by county. So I will forward this spreadsheet to Claire and or Mila, and they're welcome to share it with you all. I'm hoping that you might see some ideas on the spreadsheet that you might want to say, hey, it's worthwhile talking about maybe doing some education in 2024 on these topics. And maybe you'll even want to collaborate with some other surrounding counties to see if maybe as a region, you'd like to do some CME. And as a reminder, counties get CME credit through the Pennsylvania Medical Society free of charge when you are offering education to members. There is a nominal application fee when you start using it to include non-members as well. But we do have the prices significantly discounted when you're looking to expand it to non-members. And as always, our CME team is available to help you sort of like plan and think about what could that activity look like, what would be a great way to do it, some different formats, engaging ways to get involved. So you're welcome to reach out to me or anybody on the CME team at any time. With that, I'm going to stop. And if there's any questions, I'm happy to answer them. Otherwise, if not, I'll turn the microphone back over to Claire.
Leslie, while we have you here, we didn't list it, but I think it would be worth another minute or two to mention the Year-Round Academy and the
Yes.
scholarships.
Wonderful, thank you. So I hope that you've all seen the recent marketing, that Sam and the team have put out related to the Year-Round Academy. We are now currently accepting scholarship applications for the 2024 iteration of the Year-Round Leadership Academy. The scholarship applications will be accepted through November 26th. We have 3 different scholarships available. We have the Early Career Physician Scholarship, which are for physicians who have been in membership at least 1 year, are between the ages of 30 and 45, I believe. And those physicians are currently involved in some way in serving either PA Med, a county medical society, or a state specialty society. Those are the primary qualifications to apply. We only accept 10 applicants under early career scholarships, but I hope you'll talk to some physicians if you think that they might benefit from additional leadership training or any kind of leadership training. Maybe it's people that are serving on your boards or serving in hospitals and you'd like to help empower them to do a little bit better job. Please consider inviting them to check out the Leadership Resources website on the PA Med page. And we have a whole section devoted to the Year-Round Leadership Academy. We are accepting registrations for the Leadership Academy through, I think, February. We can actually accept it. So people can register right now without applying for a scholarship. We do have 2 other scholarship offerings. One is Emerging Leader. That scholarship is for physicians who are in a hospital-based practice setting. And then we have a Innovation and Redesign scholarship, and those are for physicians practicing in an office-based setting. Very easy to complete the online application. For those 2 categories, there is not a limit on them as long as they qualify for the number of years of membership, and they can tell us what their roles are, how this would benefit them. we usually are able to offer a scholarship. The early career scholarship is a significant discount. People who come in through the early career scholarship pay a total tuition of $250 only. That is discounted down from $2,500 to $250. The Emerging Leader and the Innovation and Redesign offer a $600 savings. So the participant pays $1,900 versus $2,500. This is a year-round endeavor. Actually, it's 10 months. We just graduated our last class last week. So they start in February with tasks, and we have some tasks spread out for them over the course of the year so that physicians are engaging a little bit, staying connected over the course of 10 months. We're not overwhelming them, but it is a very layered and comprehensive program that they can work through for the most part at their own convenience and in their own time frame. So I'll stop talking there. If anybody has any questions, happy to answer them.
Leslie, Teresa sent a message asking where to find the Social Drivers of Health initiative information.
The fastest way that I find it is if I go to the PA Med News section, and I type in Social Drivers of Health. I don't know that there is a standing website page for that. Maybe Mila or Sam has something else. Maybe they can chat in the link to get to it. But if you go to PA Med News and Resources and you search on stories in there, we initially posted the story at the end of last year, the beginning of this year. Now we have updated the page more recently, but that is a quick way to find it.
Thank you very much.
Mm-hmm.
And Sam, do you want to throw something in the chat there for?
Yep. I'll find it. Yeah, I'll throw the link into the chat.
Thanks, Mike.
I knew that my team was already thinking. Any other questions or thoughts for Leslie before she goes? I think she actually has the day off, so we're going to let her head off into the sunset unless there's any other questions.
Thanks, everybody. Enjoy your day.
Leslie?
Yes.
I said thank you. Thank you, Leslie.
I'm sorry. I missed it. Have a great day, everybody.
Bye-bye. And we'll jump in. I have a couple of things to share. The first one is just an update on the Emergency Department Overcrowding Task Force. They've been meeting for several months. As you know, we shared a letter with the governor's office asking for a task force to address the emergency department overcrowding. We and several of you signed on. If anybody wishes to still sign on, you are welcome to do that. Maybe somebody can throw that in the chat as well, as far as the link to get to the emergency department overcrowding page. The governor's office reached out to Dave and his team and helped us get a meeting set up with the Secretary of Health and I believe her title is Deputy Secretary of Health, and the governor's Chief of Staff joined us as well. We discussed the issue. Dr. Sandell, the chair, joined us and led the meeting. Our next steps, they of course understood that this was certainly an issue. Our next steps is tonight the task force meets, and they will be reviewing a list of all of the sort of main factors as they see it, and also what partners should be pulled in for those discussions on those topics. So that will happen tonight, and then we will circle back with the Secretary of Health and share that list. And they did sound like that they were going to move ahead with, as they called it, a convening. I think we're still hoping that it's blessed by the governor as a task force so that it holds that weight. But we do have movement and interest. Mila has done a great job. We've gotten some great press coverage Penn Live has covered it, as well as several other outlets. We're scheduled with, I think it's WITF, Miley, yes, shortly. And we also had Dr. Sandell on Newsmakers. I think that helped, the press coverage helped us increase our call to action. We've had 70 people take action. And I think the press and the action sort of nudged the governor's office to say, oh, wait, you know, what did they send us? Because I'm sure they get many letters a day. So that I think that helped nudge them to reach out to Dave's team. But things are moving along and we're getting some attention. And so we hope to have some action soon. I don't know, Dave, if you want to add anything to that. Wayne Crawford in Dave's area joined us at the Secretary of Health meeting.
Yeah, no, Claire, there's nothing more to add. I mean, I think just we're going to wait. I think you guys have to give them some information and follow up with them. And then we'll follow up with Lindsay Walden, who is the governor's deputy chief of staff, and kind of keep on her a little bit and see if the governor's going to actually move forward and create a task force, which is what we obviously want them to do.
Okay. Any questions on the emergency department overcrowding task force? Okay, and the other thing I wanted to share is some changes that we have coming in the way that you're receiving your data. Two things. One, we've heard from many of you, can you just please send me a list of your members and your non-members? So we're going to start doing that for anybody that's interested. If you don't want to receive list every day, you don't have to. But if you wish to receive your member list and your non-member list and your group list, what we have started piloting with Mark and Beth and Sarah and her team is a daily email that sends your member list and your non-member list, and a weekly email that sends your group list to you. If anybody is interested in receiving that, we want to start doing that soon for whomever is interested. Just send me an email and we will get you signed up for that subscription. You would also directly receive the monthly wrap-up that you currently receive. Some of you currently receive of me with just the counts of the categories. The other reason we're doing that is we're starting to see some inconsistencies in Nucleus that we don't like. The numbers are fine and some of the data is fine, but it's not as accurate as Julie's list. And we want you to have Julie's accuracy. We put into place this subscription service to be able to do that. We're going to circle back with the people that we piloted it with, and the folks that we chose to pilot it with are the folks that we know are really kind of digging into their data and using it on a very, very regular basis. I know everybody uses their data differently, and we wanted people to kind of poke holes in it and find issues before we went out with everybody. We are circling back, I believe it's next week, with that group to just discuss the list and make sure that nothing is missing from the list or anything else. And then we would like to provide that to anybody that is interested. Moving forward with that, we will also be having Julie have regular meetings that are sort of Excel tutorials, because that's how you'll receive it. It's an Excel spreadsheet. That's how we get it. And we know that everybody is not experts in Excel, and Julie has some tips and tricks that she can help, hey, you want to do this, here's a quick way to do that. And so instead, we're moving away from Nucleus and towards this function. So we want to make sure you have those Excel tips and tricks to help you kind of digest that information as you know, to make it easy for you to use. The other thing that we're going to include in the information, and this is just sort of a personal thing that I personally feel I do for myself, is if you use Outlook and you're not familiar with how to set up rules for Outlook, we're going to provide some documentation for that so that you can set up a folder that they go directly into, so that you are not overwhelmed by list every day. If that's of interest, I mean, you don't have to do it. I like to do that. That way I know where to find them and they're not clogging up, you know, my email list. So we're going to start to provide some of those tools for everybody to use. And we will circle back once we start it, which I hope to do very shortly. Again, you don't have to do that, but if you would like to just have the list, you don't have to download it. You don't have to do anything. It's just there in your email. We will sign you up and get that started for you shortly.
Claire,
Yeah.
quick question. The list that we get, is that going to be a complete list with, you know, the addresses, email addresses, everything that's updated there? Just like how we
Yes.
normally get it?
Yes.
Okay, awesome. Thank you.
You will have everything that Julie has, which is a lot. Okay, we will move on to Dave Thompson for his legislative update.
Good morning, everyone. Happy Election Day. Hopefully you've all voted, and if you haven't, you should. Legislatively, they are out this week, which they do all the time for the election. The Senate and House will be back next week for 1 week. Then they are out until December, and they will only be in session 1 week in December. So there's not a whole lot going on between now and the holidays. We don't anticipate a whole lot of movement. Interestingly, we are still waiting, everyone is still waiting for a budget bill to finally be done. You may recall us talking about the mental health line item in the budget. There was some money put aside last year, but there was more money set aside this year, $100 million for mental health related activities. 10 million of that 100 million is being earmarked for the collaborative and behavioral care models for primary care physicians to engage with psychiatrists through various hospitals, et cetera, to help manage patients who have mental health issues. If you want to know more about that, I'd be happy to talk to you offline. But we're waiting. The bill hasn't passed. It is House Bill 1300, and we're still waiting for that bill to finally get through the process. Who knows? I mean, it's all based right now on politics, and I suspect that we may see something finally done before the end of the year, but time will tell. We do, just from a political standpoint, you should know that there will be a Democrat House member who will be resigning from the House as a result of winning his judicial election today. He was unopposed. It's John Galloway from Bucks County. So he will win that seat, and then there'll be a vacancy in the House on the Democrat side, which, if you're following things, you'll know that that will then paralyze the House. They will not come into session until that seat is filled in a special election, which has to take place 60 days after he resigns. So we're not sure whether he's going to resign immediately after today's election, or whether he will remain a House member until he is sworn in as a judge in early January. Either way, whenever he leaves, there will be no session in the House for 2 months. Because if they would come back in a deficit, the Democrats would potentially lose control of the House. So it's politics at its best. However, January is usually a pretty quiet time, as is February with the governor's budget announcement and budget address. So there's really not much going on anyway legislatively. So it won't really disrupt things a whole lot. But suffice it to say, you know, we've got some things we'd like to see done before the end of the year. One is POLST. For those of you who remember that issue, the Pennsylvania orders for life-sustaining treatment. That bill has been back and forth for the last 6 years. We finally have gotten word from the House Health Committee staff that they're planning to move Representative Tariq Khan's bill. And don't quote me, I think it's House Bill 1212 maybe. I should have known that, but I don't. I'll make sure you guys know what bill it is. But in any event, that's a bill that we support. Tariq Khan is a Democrat member from Philadelphia. He is the nurse practitioner who just introduced or co-sponsored a nurse practitioner bill in the House. But we're putting that aside and thanking him for moving the POLST bill or being a sponsor of the POLST bill. If we get that bill through the House, which I think we will, at some point, it'll come out of committee before the end of the year. I don't think we'll see any action in the House until the new year. But that's something that PA Med has been working with a broad coalition of folks to get done for years. The only entity that is against it is the Catholic Conference. So we're, continue to struggle with that a bit. But I think we will win the day now that we've got a little bit different dynamics in the House with the Democrats in control. We'll see that bill passed, and I think it'll move through the Senate pretty quickly, since the Senate had previously passed that issue twice. One of the biggest issues we're struggling with right now is on the mental health arena is prescribing, allowing psychologists to prescribe medications. We are obviously opposed to that. The psychiatrists are opposed to that. This is an issue that Representative Dan Frankel introduced. There's a couple states that allow psychologists to prescribe medications. We like to say that this is going to do nothing to increase access to mental health, which is what it's being sold as, but rather it's going to increase prescriptions. And not every patient who is seeing a psychologist needs to be medicated. But in any event, it gets a little dicey because of the mental health access crisis, especially on the juvenile or pediatric side, with kids having issues and not being able to see a psychiatrist and to get meds they may need. But in any event, we are trying our best to allow the psychiatrist to sort of drive this. It is their issue. They certainly are the experts. We are not the experts. So we are working with them, certainly, and the coalition of physicians, the family docs, the pediatricians, POMA, and a handful of others. But they are, the psychiatrists are the lead on this issue. That is House Bill 1000. I don't know what's going to happen with it, even if it does pass the Senate, pass the House. I don't think there's any appetite in the Senate to do anything with it. Certainly it's a Democrat bill, so the Senate would be predisposed just on the surface of not moving it, but it always could become a trade back and forth between the House and the Senate. Again, we are really looking to our colleagues on the psychiatric side to really kind of shepherd this thing and to work with the committee staff in the House Professional Licensure Committee, and others in leadership to kind of get this thing killed. But again, we are doing our best to work with them. Nurse practitioners, you'll all be happy to learn that I think that anyone who is, even the folks who are lobbying for the nurse practitioners, admit that they are not able to move anything, that we are winning very handily, winning that issue. We started working late last year as soon as we knew that there was going to be a new chair of the House Licensure Committee, and we've been working him like a part-time job on this issue and other scope issues. So I think we have things pretty buttoned up on the nurse practitioner issue. So I think that is certainly very good. And that's really about it. I mean, it's kind of quiet otherwise, but we are watching a number of other smaller bills that are kind of hanging out there. Credentialing, we are still pushing to get a credentialing bill introduced, but I think at this point I'll ask anyone if they have any questions thus far. Let me say one thing about the PAMPAC and the judicial elections. Of course, the judicial elections are today. For those of you who were looking at the dose, PAMPAC did not endorse a candidate in either of the court races, either for Supreme Court or Superior Court. We did share the candidates' responses to our questionnaires. They're out there to be viewed by our members, but PAMPAC did not take a position on either candidate. Any questions on anything?
Was there any movement on the CRNA independence issue?
There has not been any movement thus far. I think that will certainly come back after the new year. I know that we have been talking to a couple folks on that issue, and Millard and Goodman are representing the anesthesiologist, and I think at least at this point there's been no more movement on that. One other item I'll just mention, it has not yet come to Pennsylvania, but for those of you who don't have a life otherwise and read about other states and what's going on in other states, California passed a law a couple years ago that said nurses could not introduce themselves or use the word doctor in direct patient care settings. So for nurse practitioners who have doctoral degrees in California, they're prohibited from using the term doctor in direct patient care. So that is being challenged in California by the nurses. And I suspect that, we may see some of that trickle into Pennsylvania. I know that it's something that we talk about informally with legislators from time to time. And of course, there's a lot of patient confusion, which is why we embarked on the campaign about how white coats work. And we're continuing to push that campaign a little bit. Hopefully we'll get some more money from the AMA next year to continue that campaign. But don't be surprised if you see something here in Pennsylvania at some point relative to patient confusion and non-physicians, PAs, and CRNPs introducing themselves as doctor using that terminology. No other questions? Mark, you're not going to use your big microphone to ask anything? All right. Thanks, guys.
All right, thank you. And we have our last item is Dr. Hertzberg is with us to receive feedback on the HOD, and I will check. He has asked staff to step away. So before we step away, I wanted to make sure there was nothing further for the PA Med team.
Before staff steps away, can I say something?
Sure.
So we are going to do a very free-for-all, easygoing feedback for the HOD. The reason I've asked staff to step away is because this is going to be purely used to improve the process Although I can see who's speaking, I'm not taking count of any names. I'm going to consider this all as group feedback. And I've asked staff to step away simply to sort of make it easygoing. It's, you know, we can stop the recording and things like that. And just, you know, everyone should feel free to speak, including negative things about the speakers and what they did. So that's the only reason I've asked staff to step away.
Okay, Miley, you have Dr. Hertzberg set up as host.
Yep, you're all set, Dr. Hooper.
All right. Thank you all.
Thank you.
All right. So like many of you, I'm pretty quiet in the morning. I don't like to talk to people before 10 a.m. But I'm going to ask you all